Okay, guys, this is the second part of the social stratification section for structural violence. We just talked about the patriarchy. So, economic power. There's this term in sociology and economics called the feminization of poverty. Approximately 2/3 of adults who live within the poverty range are female. There's also terms such as pink collar ghetto. This is okay, so although women have made gains as far as getting into traditionally male-defined jobs, the majority are still employed in traditional female jobs that are lower pay. So this is kind of a play on the blue collar, white collar, pink collar. So pay differentials are less than at any other time in U.S. history. So yes, the wage gap is smaller today than it was, say, 100 years ago. But this is partly in result of males' working class downward mobility as opposed to an increase in income for women. So the male portion of the working class is going down to a lower amount. So instead of the women going up to meet the men are coming down to meet the women. So among workers between 35 and over, women earn between 76 and 81% of what their male counterparts did in 2014. This is where you get the idea of the 76 cents per dollar. For those under age 35, the earnings differences between women and men were smaller, with women earning about 90 cents per dollar for what men were making. So here is some stuff from the Census Bureau. Median income, male versus female income gaps. This is only up to 2010. This is from 2016. You can see women with advanced degrees. Doesn't necessarily mean that you're going to make as much as the men do. A woman with an advanced degree past a bachelor's, so a master's or otherwise, is only making about as much as a man with a bachelor's degree. Religion, how does this relate with gender? So customs, beliefs, laws that discriminate against women are reinforced and perpetuated by religion of the area. In all Western traditions, God is male. Even though it's never explicitly said, that the pronoun he, is kind of given. If you look as far as Christianity, the story of Adam and Eve, what was Eve's position relative to Adam? And then who rules these religious organizations? In both Christianity and Islam, they stress the need for women to be subservient to men. There's some cultures that were going to look at where women are cast out during their menstruation period because it's considered unclean. There's the practice of promise rings, where fathers give their daughters a promise ring as a way of showing that she's going to control her sexuality until her father can give her to her husband. That's a male control over a female sexual body. There's no Equal Rights Amendment. The United States is one of the few nations not to have an Equal Rights Amendment. Historically, violent crimes against women were treated less seriously, less important. We've talked about that in the section on interpersonal violence, the history of women being seen as property, being allowed as the husband to physically punish the wife for any indiscretions that he saw fit. This all reflects the male's power. This begs the question, is this still the case? I guess it depends on what you're looking at and how closely you're willing to look at it. Rape laws, that's one of the few crimes where the victim is suspect just as much as the offender is. Anyone who's paid attention to the news here recently, there's generally questions on, what was she wearing? What was she doing? Why was she alone? Was she drinking? Was she flirting with him? There's really no other crime where that happens. If someone is physically assaulted on their way home and beat up very badly, no one says, okay, well, were you instigating the fight? Were you arguing with the person? Did you tell them no? So these kinds of questions aren't asked of other crimes, and if they were, people would think it was absurd. And as we said before, the reason rape laws were even enacted was because it was considered an act of theft against the husband. Someone had stolen his wife, who was his property. Husbands are still exempt from prosecution in marital rape cases in several states. When they are prosecuted, they're treated as less culpable than incidents of stranger rape or even acquaintance. And as we've already hinted on in the previous section, political power, women have more at the local level than the national. But when we look at the dominant positions, men still control the weapons of war. Marriage and family life. I know there's an uptick in women not taking their husband's name. But symbolically, it's something that's been done. But what does that imply? The children often also take on the name of the father. If the husband and wife are not married and there's a child born, generally the child is given the father's last name. Again, another symbolic gesture. There are, authority structures in the home that are tied to the role of the breadwinner, as an act of socialization. Major purchases or investment decisions are decided primarily by the male. For those of you who don't know or have never had this experience, if even if you don't need the work done, if you just want to call and get an estimate on something, use a friend's address or your parents' address or someone's address that has a home. Call a couple of companies and see about getting an estimate on some housework to be done, whether it's getting drywall done or getting a new roof or something like that. Ladies, call first. Give it a week. See if you get called back. See what the estimate is. Guys, do the same thing. I guarantee you're going to get called back a lot faster, if at all. We had the experience a couple of years ago. We had bought a new home and was getting a fence put up for the dogs, and called an installing company that worked for one of the big box stores. And the gentleman I called, asked for the estimate, gave both my name and my husband's name as someone that they could speak to if they called back. Well, they called back and I answered the phone, and they immediately asked to speak to my husband. I'm like, nope, it's fine. I got this. Talked to them about it, and they're like, oh, if you want to talk it over with your husband. Or I'm like, nope, actually, I'm the one paying the bill, so yep, that sounds fine. And then even when they came to do the work, they generally asked for my husband as the person to sign off that the work was complete and that it was to our satisfaction. And I had a nice chat with the gentleman that owned the company about the expectation that I was the one writing the check, so if I didn't sign off on it, it didn't matter what my husband thought. He apologized, but that right there, it's generally, that's how it happens. There is this expectation that these are the man's role. He's the one that controls the purse strings and such. Housework responsibilities, the division of household chores. Generally favor the male as far as not having to do as much. Males define their position as people that are just helping out. Which is funny, but in other studies, depending on what you look at, there's also evidence that women whose husbands help with a larger chunk of the household chores are often happier in their relationships, and men in those positions where they divide the household chores more equally, statistically, also have sex more often and more frequently than those who don't. So if anybody wants to take that little tidbit home and share it with their spouse, feel free to. I found it interesting. Infanticide, this is the killing of children, especially female children, is still problematic in many countries. Those would have dowry laws, and those where the land and property is only transferred to male children. Female children are not desired, so they're seen more as a liability. Or when China had their limit on how many children a couple could have. The vast majority that were kept were male. Now we've seen a tremendous surge in people not having children, people not getting married, because there's just not enough women for all of the men who are now over the age of 18 in China. Spousal abuse is still not viewed as serious as other types of violence. So how does this relate to stratification and life chances? Galtung was one of the first to use the term structural violence in his writings. He did peace studies. He defined it as the violence that is built into the structure of the society and manifests itself in the differences in life chances. He stated that in a society where life expectancy is twice as high in the upper as it is in the lower classes, violence is exercised even if there are no concrete actors that one can point to directly attacking others, as when one person kills another. So access to the means of being healthy, safe, having the means to develop one's human potential require money. And life chances are the chances in and for life. Commodification of necessities. This is part of capitalism. This is why we work. The problem in the transition to a capitalist society is getting people to work. There's taxes, and then there's the commodification of necessities and needs that are created by the markets. The more income and wealth that you have, the greater your access to chances for life. This is living in a safe environment, having a pollution-free area, adequate housing, safe neighborhoods, access to a good education, healthcare, access to enough income to maintain a healthy life and resources in general, access to clean water, access to healthy foods. We know that in the vast majority of the forms of violence that we've talked about, the less income you possess relative to others in your society, the higher your rates of victimization. In general, we know that the more inequality there is in a society, the more of the various types of violence that we've discussed are. But can the structures of inequality themselves be violent in the consequences? That's something that we're going to pick up in the next lectures, something to think about. We're going to talk specifically about how the ranking of positions are violent in and of themselves. Here are some life expectancy statistics. If you look at, this is men versus women, life expectancy by age 50, the bottom 10% versus the top 10%. This is between 4 and 10 years for women. For men, it's 5 to 12. So if you look at countries, you can see all of these dots. The US is down in this lower right-hand corner. We have lower life expectancy because we have higher income inequality. If you see Japan, They have low rates of income inequality, and their life expectancy is way above everyone else, and the same with Sweden. So life expectancy at birth. This is in the United States between 1970 and 2013 by race and gender. Obviously, not all races are shown here, but this kind of gives a snapshot of white versus minority, and black being the most disenfranchised of the minorities in the United States. The Harvard University School of Public Health Initiative for Global Health. So in 2000, or data from 2001, they divided the U.S. population into 8 clusters based on race, location, population density, income, and homicide rates. They found the life expectancy for Asians was 84.9 years. Low-income rural whites, 79. Middle Americans, 77. Low-income whites in Appalachia and Mississippi was 75. Black middle America was 72.9. Western Native American, 72. Southern rural low-income black, 71. High-risk urban black, 71. The average income is also listed here. You can see that it goes from 21.5 for Asians, 24.6 for middle income whites, all the way down to 14.8 for high-risk urban black. The greatest disparity was Asian American women living in New Jersey. They enjoyed the greatest life expectancy in the entire country at 91 years. American Indians in South Dakota have the worst at 58. The primary cause of this disparity they found was between the racial and geographic groups was early death and chronic disease and injury. So what are other factors that read into these life chances and lower life expectancies? Obesity and income. Researchers led by New York University's Department of Nutrition, Food Studies, Public Health, Food Studies and Public Health critically reviewed 90 studies, and they found that neighborhoods with decreased economic and social resources have higher rates of obesity. They also found that residents in low-income urban areas are more likely to report greater neighborhood barriers, such as limited opportunity to walk or have physical activity, reduced access to stores that sell healthy foods. They don't have as many large supermarkets. These are called food deserts, where because of the area, these larger stores that have healthy foods, produces and stuff like that, that are affordable, are not found in these areas. Some of these people have to travel 30 minutes to get to a decent grocery store. If you don't have the income to spend on the gas or the public transit to get there, or the time because you're working so much, you're going to end up eating the lower quality, lower nutritional content foods that are going to lead to higher rates of obesity. Mental health. Those with higher incomes are much more likely than those with lower incomes to report excellent mental health. And this relationship persists even when other variables are controlled, such as age, education, gender, marital status, etc. The result of self-report Gallup poll, those that rated their mental health as excellent were more likely to have higher incomes, be white, be male, those who are college educated, and those who are younger. So if we think about this as far as hierarchy, if we're looking at hierarchy, we're looking at white men who are higher incomes report that they have a better mental health status, which should not be surprising. So, maternal, infant, and child health. Here's a chart from 2015 on infant mortality rates by race and ethnicity of the mom. As you can see, white non-Hispanics and Asians, relatively low. Hispanics, a little bit higher. American Indian, Alaskan Natives, about twice what it is for Asian and non-Hispanic whites. Non-Hispanic blacks, though, this is almost 3 times the number of infant deaths as for Asian or white non-Hispanics. Low birth weights for infants is twice as high for African Americans compared to white, and this is in newborns. Rates of fetal alcohol syndrome is disproportionately higher for African Americans, Native Americans, and Native Alaskans. Cardiovascular disease as it relates to class and income. Cardiovascular disease is responsible for more than 16 million deaths worldwide, or about 30% of total global deaths. Traditionally, they've been considered a Western disease, or a quote-unquote disease of affluence, and not really a public health concern for low-income populations. However, within upper middle income and higher income countries, cardiovascular disease and their associated risk factors are increasingly concentrated among the lower socioeconomic groups. So, cardiovascular disease, these are diseases associated with stress. These are diseases associated with obesity. These are diseases associated with poor diet, lack of exercise, smoking, all things that we are seeing more in lower income groups. So can the position that you were born into have violent consequences? Institutional actions differentiate between those in different positions. How we socially interact with each other as a result of the positions we occupy, and the amount of resources that we have to be safe when a crisis hits. All of these things relate to what we're born into and how that affects our outcome in life, or even our possibility of life at all. If we look at crisis, recently we have Hurricane Michael going on right now. Hurricane Katrina was a really good example of a natural disaster that hit a already low socioeconomic area, and the majority of the people killed were the lowest income, who didn't have access to resources when a crisis happened. So these have very real consequences, whether or not you see the value in what we're saying. All right, so that's the end of this section. We are going to pick it up on, I believe, I'll post the next one shortly, but we'll talk more about structural violence and systems of stratification, and how it directly relates to these violent outcomes. So, as usual, if you have questions, you may post them to the discussion board or email me directly, and I'll get those next lectures posted. Thanks.